Today's paper is relatively easy. The start of the season, we don't want to threaten you with too tough a question paper. Of course, the medicine paper, medicine and surgery questions are slightly jostling, but overall the score, you need to get at least 150 plus in a paper like this. Right. Where will thoracic duct open? One of the traditional questions, Voice of America. T8, T10, T12. Vena cava, esophagus and aorta is what need to be remembered. Intention tremor, dysdiadochokinesia, they are all the signs of cerebellar dysfunction, not extrapyramidal. Whereas hemibalismus, chorea, rigidity, ethitosis, they are all the features of extrapyramidal system is what you need to remember. Inferior thyroid artery is very closely related to recurrent laryngeal nerve. Some of you are going to be the finest endocrine surgeons, knocking out a thyroid for the breakfast, lunch and dinner. So, inferior thyroid artery is very closely related and highly vulnerable structure would be recurrent laryngeal. Submandibular gland, it is a mylohyoid which will be dividing it into two parts, superior and inferior. So, salivary gland anatomy is one of the favorite issues for the examiner. Suprarenal gland, which vascular branches supply it? It is the inferior phrenic, abdominal aorta directly, renal artery. They are all the ones which basically supply the adrenal. Is what? Adrenal has got one of the highest blood supplies, as all of you know very well. Now, apoproteins, doctor, favorite question of the examiner. B48, B100, they both are there in which lipoproteins are called beta lipoproteins. VLDL and LDL are called beta lipoproteins. ApoA is a special thing about LCAT function of HDL. ApoC2 is a very important thing which is there in the chylomicrons and VLDL. When chylomicrons VLDL float in the blood, the triglyceride inside them is extracted by the peripheral tissues. For that, what is that which recognizes the VLDL and chylomicrons? It is the ApoC2 which is there on that. So today only you should review the apolipoproteins. If there is a Bombay blood group, the person will have anti-A, anti-B and also anti-H. All the three antibodies will be there in his serum. Why? Why all the three will be there? Basically, in the Bombay blood group, what is the meaning of Bombay blood group? They do not express any H antigen, which is also important for expressing the A antigen and B antigen. Hence, they will have all the three antibodies, anti-A, anti-B and anti-H is what you have to basically remember. Now, most immunogenic is obviously D. Anti-D immunoglobulin, Rogam, is the one which we administer whenever RH isoimmunization is suspected. Why sodium ions cannot pass through potassium channels? What is the difference between them? The carbonyl oxygens which will be lining the potassium channels, they cannot interact with the sodium ions. They can only interact with the potassium ions. That makes potassium channels impenetrable for the sodium to pass through. In the molecular structure is what you need to appreciate. Now, calcium phosphate crystals, when will they precipitate? Whenever the level of the calcium in the blood is more than 17 milligrams per deciliter. There are about 8 to 10 numericals in today's test, that is little on the higher end of the normal paper. Normal paper will have 4 to 5 numericals. Out of them 2 to around a couple of numericals everybody can answer who has prepared for exam. But a couple of numericals no one can answer unless paper is leaked. So that's the reason don't worry too much on numericals, really doesn't matter. Carbon monoxide, how will it affect the hemoglobin, doctor? Carbon monoxide, basically it will be competing for binding to the heme with a greater affinity than the oxygen. So oxygen become outdated, obsolete, staled out. Now pantothenate, every vitamin is a coenzyme. For coenzyme A you require pantothenate, for transamination reactions you require pyridoxal phosphate, carboxylation reactions you require biotin, oxidative decarboxylation reactions you require thiamine. So all those vitamins is the most high yield topic in biochemistry and also in SPM, doctor. Never ignore it. Now, which protein which is outside the nucleosome core, which will facilitate the packing of the nucleosome? Basically DNA will be in a very condensed form called heterochromatin whenever it is not replicating. It will be more loose and euchromatin whenever it is replicating. So the packaging of the DNA and chromosomes, how does it happen? There are histones. So out of the histones, it is the histone H1 which is outside the core, and inside the core you have H2A, H2B, H3 and H4 is what you need to basically remember. 3,5 exonuclease activity of the DNA polymerase 3. What is the importance of it? Okay, that slide changing sound is there. Okay.